mandibular fossa, external auditory canal, mastoid process, styloid process, occipital condyle. This is the palatine process of the maxilla, palatine bone, nasal bone, and the foramen magnum, ethmoid bone, cristagalli, cribriform plate, optical foramen, sphenoid bone, greater wing, lesser wing, sella tertia, and foramen magnum. Frontal, parietal, temporal, sphenoid, zygomatic, transverse process of the zygomatic process of the temporal, mental foramen, maxilla, vomer, nasal, what is this? Perpendicular plate of the ethmoid bone, occipital, lambdoid suture, sagittal suture, coronal suture, squamous suture. Also the, what is this one called? The mastoid process, styloid process, hyoid, mental foramens under here, external auditory canal, optical foramen. Now we have the top 7 cervical bones of the vertebral column. The next 12 are thoracic bones, 5 lumbar, and the sacral, which is the sacrum and the coccyx. Notice the shape. Transverse process, transverse foramen, vertebral foramen. Notice the dens or orodontus process, the body, transverse foramen. These are on the cervical, top 7. Thoracic has a more circular shape towards the middle and more like dagger-like spinous process. Spinous process in the lumbar is more blunt. However, the body is more round, and the vertebral foramen is more triangular. We also have the lamina and the pedicle. Spinous process, transverse process. On these we have the head of the ribs, the neck of the ribs, the tubercle of the ribs. Then you have the intercostal groove, which comes in through here. And then you have the sternal end. There are, I believe, 1, 2, 3, 4, 5, 6, 7 true ribs, 3 false ribs, and 2 floating ribs. Now we're going to go over the ribs one more time. You have 7 true ribs, 3 false ribs, and 2 floating ribs. Then you have the manubrium, the body, and the xiphoid, and that's the sternum. Superior border, spine, medial, lateral, acromial process, coracoid process, glenoid cavity. This acromial end, sternal end, sternoclavicular joint. So this is the humerus bone. You have the greater tubercle, lesser tubercle, inner tubercle notch, anatomical neck goes this way, surgical neck is this way, shaft, deltoid tuberosity. Then you have the medial epicondyle, lateral epicondyle, coronoid fossa, radial fossa, then trochlea, capitula. On the back side, you have the olecranon fossa. Okay, now looking at the ulna and the radius, we have the olecranon process, the trochlear notch, and the coronoid process right here. Then you have the neck. Then you have medial, lateral, and then the ulna styloid process down here. On the radius, you have a styloid process of the radius. You have the lateral border. You have the head of the radius. And right here is a radial tuberosity. There's also a radial neck. Scaphoid, lunate, triquesium, pisiform, trapezium, trapezoid, capitate, hamate, metacarpals, phalanges, proximal, medial, distal, metacarpal, then phalange, proximal, distal. The oscoccyx bones, we have the ilium, the ischium, the pubic. We have the anterior iliac spine, posterior iliac spine, greater sciatic notch, the iliac crest. We have the ischium tuberosity. We have the acetabulum, sacrum, coccyx. We have the obturator foramen, the pubic symphysis, and we have the sacral iliac joint. Head, neck, greater truncantor, lesser truncantor.
These are phalanges.
Medial condyle, lateral condyle, popliteal surface, patellar surface. Medial malleus, lateral malleus,
A new binder.
tibia,
I thought you were gonna go
fibula,
to skeleton.
fibula,
I think I'm
head,
gonna go to Walmart and buy a skeleton.
lateral condyle, medial condyle, tibial tuberosity, calcaneus, talus, navicular, cuboid, first, second, third, or medial, intermedial, lateral, cuneiform tarsals, metatarsals, phalanges, proximal, distal, proximal, medial, distal, phalanx, phalanx, acromioclavicular joint, coracoclavicular ligament, coracoacromial ligament. It should be coracoacromial ligament. Glenohumerus, glenohumerus, glenohumerus ligament. Coracohumerus ligament. Clavicle, scapula, humerus. Sternal end of the clavicle, acromial end of the clavicle, acromial process, coracoid process, glenoid cavity, humerus. Tendon of the quadriceps, patellar ligament, patella. We have the lateral meniscus, medial meniscus, the fibula, lateral collateral ligament, or lateral collateral, or fibula collateral. And we have the tibia medial collateral, or tibia collateral ligament, And back here we have the posterior cruciate, posterior cruciate, anterior cruciate, nucleus, nucleolus, lysosomes, centrioles, Golgi apparatus, Golgi vesicles, endoplasmic reticulum, ribosomes, cell membrane, mitochondria, lysosomes. This entire thing is an osteon, 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 osteon. Then these little scratches in here are called canaliculi. Then these are called the central canal. These are called lamella. Each ring is called a lamella. These little tiny things are called lacuna with osteocytes. Lacuna, 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 lacuna. Central canal, canaliculi, osteon, lamella, 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 concentric lamella of osteon.